Thank you so much for being on my platform, Journey and Beyond. How are you? How is life?
Oh, hi, I'm good. Thank you, Shafali. Everything good. Thanks for having me.
Right. So, Luca, I had a look at your LinkedIn profile, and what I found was you have gone from Switzerland to Brisbane, from neuroscience to co founding a center. What's been the biggest journey and beyond moment in your career so far?
Well, I think there's been maybe a number of important, if you want, period or moments in my career. I guess the first one was undertaking first the career in science, and this was motivated by a professor called Francois Schenk that at the University of Lausanne was really inspiring in undertaking the research in neuroscience. And you have to remember this was probably 25 years ago, 20 years ago. So back in the day, neuroscience was, at least in Switzerland, was not even a recognized discipline. It was something that was emerging and was, started to be teach. And then after the PhD, I guess a second moment was to take the opportunity and probably also some degree the risk to move overseas, to leave Switzerland and come Australia with the support of the Swiss National Science Foundation for get some training and start my journey here.
Nice. So, Luca, you are working in the field of mental illness, you work on depression, you work on OCD. What is mental illness and why is it so important that we understand it better?
Well, I think the definition of mental illness is you could probably define it as a wide range of disorders that affect the thinking, the mood, the emotion, and the behavior of a person to a point that it makes it difficult for this person to daily function. And I guess you could define it probably like this. And it's important to still highlight that we don't have, contrary to other illnesses where we have clear, for example, biological marker of the condition. For mental illness, we don't have that. So it's often symptoms based and some marker that are biological, but there is, it's not a clear conditional illness like, for example, say cancer or COVID.
Yeah, right. So it's something which people can't really feel or see, but it affects our daily life.
Yes.
So you work on depression, right? How does depression actually affect the brain and why is it so hard to treat? How is it different from OCD?
Yeah, well, in line with what I said before, it's depression is defined by its symptoms. There is a series of symptoms that clinicians observe, and if you have a number of those symptoms with a certain severity, a certain presence or a certain recurrence in your life, then you get the diagnosis of depression. So more and more, though, because the progress in neuroscience we start to understand also what's the brain basis of depression, what is genetics basis of depression, and so on and so forth. Right now, there is no very clear or defined marker of depression. Depression is probably not only one disorder, but it is a series of disorders. And that's probably what is missing now in the field. Across mental disorder, this is not only for depression.
Right.
Regarding OCD, well, again, OCD is a different disorder. It means that the symptoms that people observe, both clinicians observe, are different. Generally, depression is characterized by this persistent sadness, this anhedonia, this low mood, while OCD it's more related to some anxiety, to some excessive worry, irrational worries. Did I close my car excessively, or did I have been contaminated by germ, or rituals like if I don't do this, I'm gonna have I'm gonna hurt some people.
So in a way, all of us have OCD, right? Because I have OCD of turning off my stove top when I leave home every day. I'm more like, oh my gosh, have I turned off my stove top?
Yeah, I think all these mental disorder, if you want, they still debate in the field. But I guess this kind of disorder kind of affect functions of the brain that we use every day. Like for example, the reward processing, or the ability to plan, is what we call the cognitive control, the ability to plan and interact with our environments. Every one of us can have a sense of what potentially as symptoms of OCD is. Every one of us experience some degree of anxiety during their life. But of course, as I mentioned before, extent to which these manifest. For example, you may have some temporary anxiety until they close the door exiting the house, but this eventually will resolve and you will take your stairs or elevator and you exit the house. But for a person with OCD, this is so difficult to do, to leave that thought and say, no, it's fine. So again, you come down probably to how much these symptoms of these things affect your daily functioning.
So, Luca, what neurological changes happens in our brain with someone, who is living with OCD?
Yeah, again, in terms of the brain changes, we know that OCD is characterized by some neural signatures, some things in the brain, that some regions that seems to activate differently, some circuits that connect these regions seems to work differently. Exactly to what cause, what we define OCD is not yet well known, but we have definitely some initial knowledge on the circuits that seems to support the behavior and the thoughts, internal thoughts, the recurrence of those internal thoughts in people that are diagnosed with this disorder.
Right. Can technology like brain imaging or algorithm actually see mental illness?
Yeah, I think, you can kind of see or observe region in the brain that are correlated to the occurrence of symptoms. We are now able to do in humans some intervention that may give us some information about the causal implication of a region, of a circuit in a specific pathology. But we are a little bit far. We are by far from having a person coming to, let's say, an imaging facility, imaging their brain and saying you have OCD, you have a depression, and you have any other type of disorder.
What is the difference between feeling sad or anxious and having a diagnosed mental health condition? Is it just about, having severe condition, or what is it about? How is it different?
Yeah, again, currently how a medical doctor or clinician diagnose the disorder is using typically some manuals like the DSM, the ICD manual, where there is a list of symptoms and there is a list of criteria that clinicians observe, and if they meet the criteria, meaning often it's linked to also the severity of those symptoms. If you meet a certain threshold, you will be diagnosed with not just anxiety, but an anxiety disorder, not just some worries, but maybe with an OCD, obsessive compulsive disorders. Right now, the diagnoses are purely symptomatic, and they are done on symptoms based by the evaluation of a clinician.
Right. Do you think lifestyle factors like sleep, exercise, or stress physically change how our brain work? Because youngsters, like a lot of, not me, but a lot of youngsters out there go through a lot of stress in their daily life, right? Do you think all of it shapes how their brain works?
Yeah, I think there is more and more evidence, that lifestyle factor, but this is it's not only mental illnesses, any type of disease. Of course, they play a role. So you probably have some predisposition, genetics predisposition, for example, to develop a certain pathology. Some pathologies can be 100% genetics, and in that case, there is little that you can do to change it. But a large number of pathologies actually are linked. You can have a predisposition, but if you don't look after yourself, you don't do exercise, don't have a social life, you don't eat well, and so on and so forth, you don't do exercise. Of course, the likelihood that you're gonna flip on the other side is higher if you don't. And there is again more and more evidence that preventative, if you want, medicine or preventative action that people can do are really important to try to maintain good mental health.
Right. Do you think in the field, because mental health is a growing field now, right? A lot of people are paying attention towards mental health. Earlier it was, it was always connected or linked with having to go to a psychiatrist, and you have a psychiatric disorder. People used to stigmatize a lot about mental health, but now people are so much more open to hear about mental health. Do you think the mental illness could be treated as precisely as physical illness like diabetes or, say, heart disease?
Yeah, I think it's an interesting point. I think the stigma surrounding mental health is decreasing. That you're right. I think it's at least surrounding certain type of mental health. I think there is still disorder like schizophrenia, like obsessive compulsive disorder, that are highly stigmatized, and people, if we take obsessive compulsive disorder, because they, for example, the intrusive thoughts that they experience, the nature of those intrusive thoughts, they feel ashamed and they are not willing to share, and therefore there is not there is a lack of contact with the health providers